Welcome to Gut Fit Club. A Gut Fit Club is online initiative by Kaizen Gastrocare. It's about well-beingness of your stomach, your liver, your colon, rectum and whole digestive system. I am Dr. Samrat Jankar, a board certified colorectal surgeon, advanced laparoscopic and GI surgeon based here in Pune, India. Today we are going to talk on fistula in ano. Doctor, why this fistula is so frustrating? Why this come back again and again? That's what the question asked by one of my patient who visited me last week, had prior 3 surgery done in last 4 year. Again, last after surgery of 6 months, he is there with discharging from the perianal region. His question is genuine and we will go through this. I will request all of you just subscribe our this Gut Fit Club channel for your digestive health talk and well-being concept. We will bring back many of such kind of videos and it will help to grow our channel. Fistula is nothing but a small tunnel which connect inside the anal canal to outside your skin. Most of the fistula are like this. Those are called transventric fistula. Why fistula is so much of frustrating? It's not frustrating for the patient, it's also frustrating for the surgeon, because in fistula there are 2 major concerns. One is success, that is complete cure. If it is doesn't cure, again come back, that is recurrence. Second is about the incontinence. Fistula disease where we are being a patient demanding to the surgeon something else. We want such a treatment where we should not have pain, we should not have wound, we should not have this. All this are hypothetical. If some surgeons tells that I will do fistula surgery, you will have 100% success, no incontinence, no pain, no wound. Either there are 2, he is not doing surgery, just making you feel that he has done surgery, or he is lying completely. In fistula, practically it is a disease having the tunnel that has to be completely taken out. If we take out completely, then only there is a chance of recovery, there is least chance of recurrence. And most important, why the things important in fistula to understand is there is no surgery. If we just go through Google surgery about the fistula, you will get n number of names, even country to country different procedure has been devised by surgeon. When one disease, n number of surgical names if we get, that means one thing is very much clear from the surgical side, there is no specific treatment has 100% success. There are 2 reasons why not 100% success, because fistula has multiple ways, multiple branches, so chances of recurrence is inevitable. Again, second problem of fistula is one simple gland which got infected and land you into such a frustrating disease, such 8 to 10 glands are there in your anal canal. So even one get cured, other may be potentially going to have a fistula in upcoming days. So for that, in fistula there is no treatment, including what has been propagated by the market about the laser. No treatment is 100% successful. Why we need to understand about the incontinence is, we sit routinely whenever we get the call, natural call that I need to go to the rush to the toilet, we can delay, we can voluntarily control. That control is called continence. How can we control? Whenever the shit or excretory matter, waste matter comes in the rectum, then we get that urge of defecation. But if suppose this place is socially not acceptable, we have a control, voluntary control through the anal canal. Over that we can delay that process. And when we reach to the socially acceptable place, then automatically the process of defecation happens, in that there will be set pressure from the diaphragm, from the abdominal wall, from the rectum. The pressure is created from the above. At the same time, the gates will open. That anal canal muscle, what we voluntarily controlling, those opens up and shit will go out. That is most sophisticated process happen, known as defecation. So this control is in our hand, and the worst problem of fistula, it goes through this sphincter. Those are external sphincter. In external sphincter, it is about 4 centimeter. Lower 30%, if it is going through that fistula, even if surgeon divides that, it may not going to cause any incontinence. But if it goes more than that 30% of external sphincter, possibility that incontinence will going to be. And if there is a chance of incontinence, that fistula is called complex fistula. When we are having some disease, if we want to radically cure complete kind of any kind of cancer, surgeon will remove it, we get cure completely. But in fistula, if you want surgeon to cure you 100%, he need to divide your external sphincter completely. Division of external sphincter completely is going to be devastating than what you are having today. So quality of life will be mess. If the surgeon divides completely external sphincter, you are incontinent, then quality of life goes to the hell. So being a patient, what should I expect from the surgeon? We should not be demanding to the surgeon, do this procedure. I want laser, want to get cured of my fistula. You are doing the wrong thing. I want something, should not have any wound. You are doing wrong thing. This is not your face you are going to show to someone. This is your butt. You want to get rid of the problem. You should not be demanding your surgeon, I want some painless fancy procedure. This absolutely wrong you are doing. You need to discuss at the OPD of your surgeon. Preferably find out the expert colorectal surgeon, board certified colorectal surgeon, or someone who is doing good number of fistula surgery. Someone is genuine, who is able to talk you what is your problem, what is exactly expectation should have, what is going to be outcome, what is going to be chance of incontinence. Another one major problem, being a human being, I want stat treatment. Being a human being, I want instant result. This is happens in most of the cases of surgery. Kind of you are suffering severe pain with appendix, surgeon comes, remove laparoscopically, next day you are happy, the story ends. That is instantaneous result. You are suffering from something, kidney stone has blocked your ureter and you are suffering hell. Surgeon comes, put the cystoscope, no cut, nothing, and stone comes out and you will be free. Next day you feel that as if no problem has happened. But friends, in fistula doesn't happen like this. And in perianum, any procedure doesn't come like this. These will have pain, these will have wound, your shit will come, again it gives a problem, but these are temporary. Your wound of perineum heal very well, your pain will be few days after that pain will goes off, and your recovery will be very good afterward. Discuss with your surgeon about the success rate, discuss with your surgeon about the recurrence, discuss with your surgeon, most important, about the incontinence, how much is the complexity. If possible, get done the MRI, sit with the surgeon and discuss all the process, and also about post-op care. In fistula, you need good post-op care. If your surgeon along with you in the journey of post-op care, then only we are going to have good outcome. So fistula is frustrating disease, but surgery is the only option. Find out good surgeon who can help you, handhold you to get out of this trouble. In spite of doing best, recurrence is going to happen. Don't worry about that. Today's journey, find the best person to go out of this frustrating problem. Thank you.